A big change in Kentucky as it becomes the first state to impose work requirements for many Medicaid recipients in order to get coverage. The change will require adults between 19 and 64 to complete 80 hours a month of community engagement to keep their coverage. That includes getting a job, going to school, taking a job training course, or community service. Joining me now from Louisville, Kentucky, is Governor Matt Bevin. Governor, thanks so much for being here with us. What do you hope to change with this newfound freedom that Kentucky has?
At several levels, we want to have people engaged in their health outcome. It really ultimately will lead to better health outcomes. When people have a vested interest in something, they take it more seriously. They are more involved with it. And so I think having individuals that are capable of working in exchange for the things they receive, infuses them with dignity. And that's something that every human being ultimately desires. I
agree with you in terms of like the dignity in work. Even the Pope said that last year. And so I understand that's important. How do you determine, or who will determine, a capability to work? Who is able to work? That's something that I don't understand. I mean, that's a subjective decision, right?
It is to a degree. I mean, bear in mind, when Medicaid was created, it was designed for the medically frail. It was designed for the elderly, for pregnant women, for children, for the blind. It was for folks that truly were infirmed. It has since been expanded to people like you and I, able-bodied, working age, without dependents, needing us to be home caring for them. It is for that latter group that we're talking. If you are not disabled, if you do not have a dependent to care for, you will be expected to do something in exchange for that which is given to you by the people who are doing the very same things themselves.
What kind of pushback are you getting from, well, whether it be political opponents or caregivers who are concerned that this could make people actually not want to get care, that they would forego getting care, and that it would just make things worse because they would not be getting preventative care and they might just go to the emergency room like before?
Now, again, I don't think that'll be the case. I think people want to work. I've heard good feedback already. I grew up this way, Dana. I grew up well below the poverty level. I had no access to health care until I was in my 20s. I was an active duty Army officer. I know that being treated, as Seema Verma said, who's the administrator of CMS, who said when you treat people with the soft bigotry of low expectations, it's the wrong thing to do. And I agree completely. That is the wrong thing to do. People have the capacity for more. And there are 1,000 hypotheticals about what might happen, what might occur if people don't get engaged. But I am willing to bet on human beings doing what's best for them.
Well, there's just as many hypotheticals about what might happen if people find out that they can work and that they enjoy it and they have a good reason to get up in the morning. Can I just ask you one other question about what happened?
Sure.
Not just in Hawaii, of course, there was this false alarm, and the FCC chairman had this to say about what went wrong. Listen.
Two things went wrong. Number one, there was a human error, and the state of Hawaii did not have safeguards in place to prevent that human error from causing a false alert to go out. The second problem was that the false alert persisted for 38 minutes, and it took a long time for the State Emergency Management Authority to essentially cancel that alert, to let people know that it was indeed a false alert.
Curious to your perspective as a governor. I don't want to pile on Hawaii, but obviously this was a grievous mistake. What can governors do to try to prevent it? And do we need more of a federal system to prevent that from happening?
I think states need to work along with federal authorities. It's what we do here in Kentucky. We have three groups, the Homeland Security folks, the National Guard, and the federal, who need to work together. We have redundant systems. We have backup. All three have to confirm something before an alert would go out in this state. We test that system quarterly. So we are well prepared not to replicate this. Part of this is driven by my former experience in the military. This is something I was very involved with, what was at the time a top secret program related to nuclear weapons. And so I have personal experience in why you've got to make sure you get this right. And again, it isn't a function of piling on. I think many states and our nation have learned a lesson. Yes, it would seem to be driven by a particular state's experience, but we should all learn from this and be grateful for the fact that A, it was not an emergency, and that B, we can learn how to be better prepared for these things going forward.
All right. Well, I wanted to talk to you last week as well about prison reform, so we'd love to have you come back and tell us about your efforts there, because Kentucky is doing a lot of innovative things. We appreciate you coming on. Kentucky Governor Matt Bevin.